Hi everyone, I'm Dr. Chang Chen, a pediatric orthopedic surgeon from Taiwan. Today I'll be sharing how to perform preoperative planning for deformity correction surgery using Microsoft PowerPoint. While there are many commercially available software tools designed for pre-op planning, they are often expensive and may not be accessible to our surgeons. In contrast, Microsoft PowerPoint is widely available and with the right approach can be a surprisingly powerful tool for surgical planning and simulation. In this presentation, I will demonstrate how to use PowerPoint as an effectively tool for surgical planning in deformity correction surgery. Core principle of lymph deformity correction can be summarized by the mnemonic map the ABCs. M. Measure the MAD. A. Analyze the joint angles. P. Pick the deformed bone. And then we determine the apex of deformity. Choose the bone cut level. Finally, do the correction. So we measure the mechanical axis deviation. In this case, after analyzing the joint angles, we identified that the deformity originates from both the femur and the tibia. Therefore, we apply correction for both bones to achieve an anatomical realignment of the patient's left lower limb. Let's see the demonstration of the case. First, we choose the tibia to correct. Then we perform the osteotomy for the tibia and correct the tibia. Then we go to the femur, perform the femur osteotomy, and then put bone chip we took from tibia and to achieve the opening wedge osteotomy for the femur. So finally, the mechanical axis get restoration. This is the final result of the simulation. And this is how we do it in the real life surgery. And this is the intraoperative x-ray to demonstrate how we get the anatomic realignment. And then this is the pre-op appearance and the post-op appearance of the left lower limb. So how to do the deformity correction simulation with Microsoft PowerPoint? We need two steps. Number one, osteotomy simulation. Number two, the correction simulation. So to get the osteotomy simulation, they include two parts. Number one, we insert the shape, which is freeform. And number two, we merge the X-ray and the shape into the fragments. So on the control panel, you can see this one is the freeform shape. And in the shape format tab, you can find the fragments option. To get the correction simulation, we need to do the morph transition. The morph transition is located in the transition tab, and you can choose this one. So let's see how to insert the freeform shape. In this case, we're going to do the closing wedge osteotomy of the tibia. So we're going to take a triangular shape from the tibia. The first osteotomy line should be parallel to the joint line, and the second osteotomy should align with the diaphyseal axis, and then we get the triangular shape. Now, let's see how to do the merge shape. So first we choose the image, and second we choose the shape, and then we go to Shape Format tab, try to find the Merge Shape, and then Fragments. So then we get the fragments of the X-rays. And finally, we do the morph transition as a deformity correction simulation. Let's see how to do it. Number one, we duplicate the slide, and number two, we move the bone chip, and then yes, this is the simulation of the bone chip removal. Next, let's see how to do the osteotomy for the tibia and the fibula. We complete the shape at the exact level where we want to do the osteotomy, and then keep drawing, keep drawing, keep drawing, all the way back to the beginning. Then we get the shape. And then we're going to merge the shape into fragments. We choose the X-ray first, and then choose the shape, and then merge the shape into fragments. So now we get the fragments. Finally, we do the morph transition to let's see how we get the correction of this bone. We rotate the fragment and move to the destination, and then we know this is the final result of the tibia correction. So finally, this is we get the proximal tibia angle to 87 degrees, which is perfect for the deformity correction. So for recap, how to do the deformity correction simulation with Microsoft PowerPoint. You need osteotomy simulation and correction simulation. To get osteotomy simulation, there are two steps. Number one, we insert the freeform shape, and then number two, we merge the shape and the X-ray into the fragments. And then finally, we do the morph transition to simulate the correction. And this is